I'm Michael Berend, one of the orthopedic surgeons at Midwest Center for Joint Replacement. Had a long career in hip and knee replacements and now specialize in both primary, partial knee replacement, total knee replacement, and then revision knee replacement surgery. Our culture is focused on what we're most passionate about, and as a group, we're most passionate about taking the pain out of joint replacement, and we call that TPJR. So we've applied that to the patient experience, to answering the telephone when you're trying to be evaluated, to the day of surgery, and to the ultimate recovery. Same day or outpatient surgery is relatively new in joint replacements. It's come on in the last 15 years. You would have a joint replacement and then stay in the hospital for somewhere between 10 to 21 days. Now you're home in roughly 3.5 hours. We focused more on cultural improvement probably than any other aspect of our whole organization. And I think from the first time you walk in, that's palpable. So we try and sit down, remove technology as a barrier between us and the patients. So we don't have any computers in the rooms. We assess the situation, what's wrong, what's the diagnosis, and then the surgical experience, we try and make that as human to human as possible and try and make it one-on-one, bearing people's burdens and helping them get better. And really feel like we've received a lot from the community, so that's our motivation for giving back. We've extended that far beyond Indianapolis. All 5 of our surgeons have traveled internationally. We take our whole team from here on the road and have done thousands of joint replacements for those in the most need around the world. We want people to return to whatever level of function they want to. Gotten rid of restrictions after both hip and knee replacement now. So if people want to snow ski, great. If you want to train or do Ironman, cycling, swimming, running, these implants will hold up and do it. We try and offer custom levels of care to each patient.